We've all heard it before, laughter is the best medicine. But how true is that when it comes to mental health? Can cracking a joke really soothe the weight of anxiety? Can a burst of laughter truly interrupt the pain of depression, even if just for a moment? Today, we're digging into the powerful, complex, and sometimes controversial role humor plays in the world of mental health. Because the answer isn't as simple as yes or no. Let's start with the science. When we laugh, really laugh, our brains release a cocktail of feel-good chemicals, endorphins, dopamine, and serotonin. These not only improve our mood but reduce the physical symptoms of stress. Laughter also lowers levels of cortisol, the stress hormone, helping to calm our nervous system. Our muscles relax. Our heart rate slows. Even our immune system gets a boost. So biologically speaking, laughter offers real benefits. It's not just in our heads. But the power of humor extends beyond science. It's also a tool for resilience. For many, especially those living with chronic conditions or trauma, humor becomes a form of survival. A way to say, yes, this hurts, but I'm still here. Comedy gives us distance. It helps us look at pain from a safer vantage point. And sometimes, that shift in perspective is exactly what we need to keep moving forward. This is something therapists and psychologists have recognized for years. Laughter therapy, yes, that's a real thing, uses humor to reduce anxiety and improve emotional well-being. Some forms of cognitive behavioral therapy even integrate humor to help patients reframe negative thought patterns. And it's not just in clinical settings. Think of comedians like Robin Williams, Hannah Gadsby, or Bo Burnham, people who have used humor to explore deeply personal struggles. Their comedy isn't just entertainment. It's connection. It says to the audience, you're not the only one. That kind of validation can be healing in itself. But, and this is where the controversy comes in, humor isn't always healing. Sometimes, it's hiding. Sometimes, we use laughter to avoid vulnerability, to deflect attention from what we're truly feeling. We crack jokes instead of saying, I'm hurting. We laugh off trauma because sitting with it is too painful. That kind of humor isn't always bad, it serves a purpose, but when it becomes the only way we process emotion, it can prevent true healing. And there's another layer, the risk of harmful humor. We've all heard jokes that punch down, jokes about suicide, mental illness, or therapy that aren't just unfunny. They're damaging. They reinforce stigma. They send the message that mental illness is something to mock, not understand. And for someone struggling silently, hearing that kind of humor can be the reason they keep their pain hidden. Then there's gallows humor, the kind of comedy that lives on the edge, often dark and raw. It's common in professions like healthcare, emergency response, or even among those facing life-threatening conditions. For some, it's an outlet, a necessary pressure release in a world that feels heavy. But it's also controversial. What's comforting for one person might feel offensive or jarring to another. So what's the line? What separates healing humor from harmful humor? The answer depends on three things: context, intent, and audience. When humor is used with empathy, when it creates connection rather than isolation, it can be a bridge. It invites people into the conversation. It softens the fear and judgment that often surround mental health. But when humor dismisses, degrades, or silences, it becomes part of the problem. Still, at its best, comedy is a connector. A shared laugh over something painfully relatable can be more powerful than 100 motivational quotes. It cuts through shame. It reminds us that we're human. It says, I see you, and I felt that too. And in a time where loneliness is at an all-time high, that kind of emotional connection can be life-changing. So, can humor heal? In many ways, yes. It can lift us. It can help us breathe when the weight gets too heavy. It can open the door to vulnerability, connection, and even professional help. But it's not a cure-all. Laughter, no matter how healing, doesn't replace therapy, medication, or a strong support system. It's one tool among many, powerful, but not perfect. The truth is, healing isn't just about joy. It's about allowing the full range of human emotion, sadness, anger, confusion, even silence, alongside the laughter. So yes, crack the joke. Watch the funny video. Laugh at the absurdity of life. But also, check in. With yourself. With others. Ask what's behind the humor. Because sometimes, what someone truly needs isn't a punchline, it's permission to be real. And if they can do that through laughter, all the better. Because sometimes, humor is the doorway to healing. Not because it fixes everything, but because it reminds us that even in our darkest moments, we're still allowed to smile.